welcome to another episode of LEMD's educational series, where we're on a mission to empower healthier, longer lives through cutting-edge education, innovation, and community care. We're so glad you guys are all here. And tonight, I'm actually co-hosting with Janet because I'm in South Carolina,
Hello.
the founder event. So I'm going to do an introduction and I'm going to pass it on to Janet from there. And Dr. Wagner is going to do a wonderful job. But let us go ahead and introduce Dr. Wagner. Dr. Josiah Wagner is a leader in integrative medicine, peptide therapy, and hormone optimization. His journey began at just 16 after a debilitating back injury. Refusing to accept a future of chronic pain, Dr. Wagner explored peptides, stem cells, and biohacking, igniting a lifelong mission to help others heal, recover, and thrive. Now serving as Director of Clinicals at RX Reinvented, Dr. Wagner trains providers nationwide in breakthrough therapies that blend modern medicine with the science of longevity, covering everything from weight loss and anti-aging to total body wellness. Dr. Wagner, we're so glad to have you back here. Go ahead and introduce yourself, maybe give us a little background on your journey and what brought you here, and let's get started on tonight.
Well, thank you again, honey, for having me here. I think that introduction pretty much covers everything for the most part. So again, I didn't start in the seat as a doctor. I started as a patient trying to explore these things, with myself and my own healing journey, because there really were no answers for what I was truly suffering with. Is there a lot of background noise? They're doing like some construction work out here. I think I picked a bad spot. No, you guys are good?
You sound good.
Okay. So yeah, there really just wasn't any answers. I was 16, debilitating back injury, went through the whole medical system, and it was kind of an enigma, and they really couldn't offer me any type of hope. And, so I started exploring alternative options, and I've kind of been able to piece all these things together, from hormone optimization to peptide therapy to lifestyle optimization to pretty much anything and everything, and synergistically see how those things work together.
All right, well, thank you for that. Let's start with the foundations. Can you walk us through how peptides like GHKCU and BPC actually work at a cellular level to support tissue repair and long-term vitality?
Yeah, so
or actually maybe before we get started, for anyone who's new here and for some people who want to hear it again, why don't you share with us what peptides are? Let's start from the foundations and work our way up.
So
this meeting is being
two important definitions need to take place. So a lot of people go to a doctor, we're very used to being prescribed a type of medication, and that's all based off of pharmacology concepts. And pharmacology works on basically treating a symptom and shutting down a pathway to get a desired result. The problem is a lot of times with blocking a pathway or shutting down a system or rerouting something through pharmacology, we run into a lot of long-term side effects where, the patient may symptomally be better, but internally they don't feel better. And with peptide therapy, it works very differently. These peptides are doing 100 different mechanisms of actions in the body, and they're working at a cellular level. So like, what do I mean by cellular level? Like, all your tissues, organ systems are made up of cells, individual cells, then groups of cells, which makes these tissues and organ systems. So when we directly the cell, we're able to cause a change in that cellular function and then help that organ function and then improve that overall system. So we're not just fighting symptoms. So in summary, peptides help with cell-to-cell communication. They help balance the body. They help increase the efficiency without those potential long-term side effects. We're not forcing the body to do something that is unnatural to it and that it doesn't know how to do. So that's what's nice, is we can take a variety of different patients, let's say like me or you, and we can put us on a similar protocol, and it meets us where our physiology is at.
Okay, wonderful. Well, thank you so much. I'm going to now kick this off to Janet to ask the questions. And guys, for all of you, please post your questions in the chat and Dr. Wagner will get to them. Thank you all so much for allowing me to kick off this event. And I think, Janet, you got it from here. Thank you all.
Thank you. Thank you. Okay, so now that we have the foundation, let's start with like GHKCU and BPC, which are actually some of our personal favorites at LE. How do those work specifically? Let's start with GHKCU and then we can go.
I'm gonna start writing those out so we can get into like the nuts and bolts of it. So again, each of these peptides have multiple different actions that they're using. They're affecting 100 different gene expressions, and they have what's called as like primary, secondary, and tertiary modes of action. And that will get a little bit more clear as I start to break this down. So I'm just going to make my list of peptides. We got your BPC 157. I'm actually going to put TB 500 here as well too, and then your GHA. So these are the primary peptides right here, and depending on what we're looking at doing, how they work within the body is when I'm thinking of BPC 157, one, I'm thinking musculoskeletal issues, and then I'm also thinking tissue-based healing. Tissue healing. And the main way that BPC 157 drives up tissue healing is it helps with a process that's called angiogenesis. So it's increasing blood flow systemically throughout the entire body to those areas. So BPC 157 is great, for any type of like ligamentous, muscle, or connective tissue issue, whether a patient has like a shoulder, a knee, an elbow, whether it's acute or chronic, BPC is definitely one of those major peptides that I deploy in those states of helping that tissue healing and regeneration. Now, TB 500, if you look that up, it will also say tissue regeneration as well too. But the thing is with the tissue regeneration, it actually has one unique form of action. It's called neonatal genesis. Now, what I mean by neonatal genesis is it's like, let's take a tissue cell, we'll extrapolate it out through time, and then it's exposed to a lot of damage. And then if we add that TB 500 to it, it takes it back to that original state. So the original state that tissue was in. So we can basically reverse all the damage. So we can use this along BPC 157 or those tissue damage issues. But what I really like to use this one too is in terms of like not only like tissue-based issues or pre-surgery or post-surgery, because it dramatically cuts down any type of recovery time. If someone is getting like a shoulder surgery or hip replacement or knee replacement, it definitely like decreases that time of injury. But it's also great in growth. So stroke patients, if you can get someone on TB 500 right away within like a stroke, that neonatal gene expression basically reverses that quote unquote damage that can happen through the stroke to basically like nothing. Like you won't even know that person had a stroke. Like that's what's super about these types of peptides, because I don't know any other therapy that someone can take post-stroke to help restore not only function, but the structure of what could potentially be damaged. So those are two huge mechanisms of action. And again, we can extrapolate these peptides out way farther. Like I could talk about using TB 500 for eye drops and restoring eye health because it helps with the corneal structure of the eye, breaks down the inflammation, and restores the corneal layers. That's another one. BPC 157 It also pairs really well with like the growth hormone peptides, such as like Simorelin, because it upregulates the growth hormone receptors and amplify it. So again, these things have so many layers, just depends on the patient's out-term goal on what you're trying to look for with these.
Mm-hmm.
Now, GHKCU is also a super unique one because we can use this in so many different varieties of ways. Because of the amino acid structure, we can use it topically to help regenerate skin cells or satellite cells in the hair, so we can restore the satellite cells in the hair, such as like the satellite stem cells. So we can use it for hair, we can use it for skin, we can use it for tissue regeneration. So this is another super healing peptide. But what I like about this one the most is it helps with stem cell migration. Other words, oh gosh. And stem cells are at the base of any healing injury. So you can put all these three together because again, stem cells are at the base of tissue healing. They're at the base of neonatal uh, genesis and helping with stroke. So that's where it's like we can start to layer these things in and get these amplifying effects, and you can see dramatic results within like 5 days, 14 days, 4 weeks when you start to layer these because we're affecting so many different systems. It's like kind of like baking a cake. You know, you just don't use flour, you don't use just sugar, you just don't use eggs. It's like when you combine all these different ingredients together, depending on like what your outcome is, you're able to make something totally different. So this is like where the alchemy and the art of medicine like really comes into hand, is being able to layer these things in together.
Mm-hmm. Can we go back to BPC really quick? I have a few questions in the chat. Someone saying, would BPC help with my tendonitis from arthritis? And then someone else said they have arthritic knees. Would it, if injecting BPC in their knees, would that help? Or near the knee? And then I guess if you could explain like where near the knee.
Yeah. So yes, it can help with any type of itis condition because itis is just like an inflammatory issue of the tendon, ligament, or joint. But in terms of the arthritic condition is typically linked to an immune system dysfunction. When the arthritis is happening, usually your immune system is hyperactive. So that's where the combination of these two covers not only the itis or the inflammation, but also that immune system dysregulation. Because when someone has arthritis, they have Th1, Th2 imbalance in your immune system. But prior to that, before that happens, you typically have some sort of chronic inflammation issue. So that's where, I've used BPC in combination with TB 500 for, a patient that was suffering from a hip injury, and they work with their hands, they build guitars, and the arthritis in their hands went away because
Wow.
again, affecting all these different systems. So this TB balances this guy right here, brings balance to that, and then the BPC brings balance to this right here. Now, in terms of where you need to inject it, again, these things are going to work systemically throughout the entire body. But if you want to work on a joint, you can inject it closer to the desired joint. Again, there's different schools of thought. Some people say it doesn't matter. Some people say it does. So this is where you can experiment with yourself. Like if you do have a knee, you can inject it closer to the knee area into the soft tissue, or closer to the shoulder and the shoulder. Or if you don't feel comfortable, you can still inject it into the abdomen or the lateral glute, and you're still going to get some overall systematic benefits of those healing peptides.
Mm-hmm. Yeah, so I think Lee's iPhone, this answers your question. How do you direct healing to a specific area in the body? From what I'm understanding, BPC and TB500 is one of those peptides where you can kind of inject closer to whatever area
In
you
the
need
body,
help.
and this is where sometimes people need to run a couple cycles. And what I mean by cycles is, to me, a cycle is 8 to 12 weeks on, 4 to 6 weeks off, because your body is going to prioritize the healing that it needs to do. So maybe there's something else in your body that it needs to help with first before it helps to render or repair that tissue-based injury, because it's going through your system. Your body has a list of things that it's constantly trying to do. And maybe that knee injury is like on checklist number 3 because you got the immune system here, immune right here, and then you have inflammation right here. So this is where, maybe the first cycle you run it, it gets rid of that inflammation. Second cycle you run it, it balances the immune system. And then the third cycle is where you start to really see a lot of benefits. So, because and during this time too, it's doing different percentage. Let's say like 60%, 30%, and 10%. So it's hitting everything at once, but at different percentages, because it has to work through these things systematically. So this is where people need to give it a long enough time to work. You can't expect it to fix your issue overnight, because you didn't develop the arthritis overnight. You didn't develop the immune system issue overnight. You didn't develop the chronic inflammation overnight. So this is where you want to give it a good 3 to 4 months period to allow your body to heal and to render a lot of these issues.
Mm-hmm. Mm-hmm. And so one thing that I don't think is talked about enough with BPC and TB is like we always talk about like restorative in muscles or ligaments or tendons or joints. But can you talk a little bit about like the gut and how it's not just external but internal as well?
Yeah, so like the biggest thing with this is BPC 157, it's specifically synthesized from the gastric juice within your stomach. So like that's where your body naturally produces these BPC peptides. With that being said, the BPC 157 is going to help restore some sort of gut function. Again, everyone is this is where you have to write about. So like whether it's arthritis, whether it's immune system dysregulation, whether it's gut issues. So let's say this line is like gut, and this is a linear line. This is like no issues. This is like major issues. Everyone's going to be on a different point on this line right here. So not everyone's gut issue is equal. So again, some people might feel it right away because they're here at this point right here. Some people could be way over here. You're gonna still feel improvement right away from starting it, but it's not gonna render it because again, this is gonna be layered with a bunch of other issues going on. So this is where I don't want to say like, yeah, just take BPC, it's gonna solve all your problems for your joints and for your gut. It's not. It's a huge component and it's a huge piece that can help with you to start that healing process. But for some people, it just might be the start of that healing process.
Mm-hmm. Mm-hmm.
And it depends on like how long you've let it gone for, that we might have to do it either like longer or larger doses or add some other components in there. But the nice thing about running BPC is you're not doing any more damage to the area. For example, people take NSAIDs for pain, and what's nice about an NSAID is it does dramatically bring down that inflammation. But the problem is it decreases your body's ability to produce prostaglandin, which is very much important in terms of your body's ability to promote a healthy gut healing. So again, these issues are like can be very complicated and very layered, but they're not complex when you run through some of these cycles. Again, you are going to experience some form of relief, and we're getting to the root cause issue.
Okay. And now shining the light back on GHKCU for a second. You might have touched on this earlier in the call, but if you could draw a picture for us visual learners. So how does it work on a cellular level, and how does it actually support tissue regeneration? Because I'll speak from my own experience with the LE Skin Plus. I mean, you could see it, like it is working, and I could see my skin like regenerating and almost like a reptile when they shed their skin for that new fresh skin. That's what it felt like for me. So how does that work, or why? Or
Well, again, so if you ever look at GHK, if like when you pull it out of the syringe, or if you see the color of it, it's this like really vibrant blue color. That blue color represents a high level of antioxidants. So what it does is it gets rid of, so like ROS, reactive oxidative species right here. So this is what causes a lot of tissue damage, is we have a lot of these reactive oxygen species that are causing a lot of oxidative stress within the body. It's basically like causing your body to rust from the inside out. And your skin is actually a reflection of your internal health. So the more that we can improve the internal health, whether that's gut, whether that's chronic inflammation, whether that's immune system dysregulation, those things in themselves are going to reflect healthier skin on the outside. Now, again, GHKCU, it has high antioxidants, so it helps with neutralize this reactive oxygen species. So like your skin is not being burned out as much as possible. The other huge part is that stem cell production. The cells on the face, we have to have more turnover, because the reason we get all the wrinkles is our body, as we age, our stem cell production dramatically drops off a cliff. So your body's just not regenerating at the same rate that it was when you were young. So like when you're young, you get a cut, that thing heals up super fast on like little kids or teens or adults. Same thing, if you get an injury, you bounce back really quick when you were younger. It's because you have high level of stem cell production. So your body's like in a super healing state all the time. So by taking that GHKCU, we can simply put your body in that healing state to restore it back to when you were younger and get that regeneration so much faster. So it's just improving the regeneration process.
yeah, that's so true. Because I was telling someone I had a scratch on my arm, and normally like the scab goes away in 1 to 2 days, but it's like been there for a week, and I'm like, what happened? Like
And
it's just not.
we see this out in especially people that have metabolic dysfunction. Your body's ability to heal is very slow, because biggest thing in hospitals, especially with diabetic patients, is when they get those bed sores from sitting there. Bed sores will never heal up because they have that metabolic dysfunction, that insulin resistance. Their body doesn't heal the same. That's the same thing. We have a lot of people, especially in America, we have an underlying metabolic dysfunction, and then again, the aging process just naturally drops down that stem cell production. But we can restore that with peptide therapy, because your body, GHKCU is actually in the plasma of your blood. If you isolate your blood, spin it down in a centrifuge, you can pull the GHKCU out of it. And again, that starts to dramatically decrease from the age of 30 and on. The concentration of GHKCU dramatically goes down. So again, this is where we can tap into peptide therapy to basically refill up your fuel tank.
Yes. Oh my gosh. Okay. So TT asked, when will these peptides be back in stock? And TT, I don't know if you know this, but our birthday is coming up. And so we have a ton of birthday rollouts and new things and lots of things to celebrate. So stay tuned. Our birthday month will be loaded with lots of things. I'm not promising anything, but you may or may not sneak peek for this call. See that one coming back.
Yeah, I
During our
know
birthday
everyone's
month.
working hard behind the scenes to get all these things back because again, we got to go back to the basics, how peptides work versus basic pharmacology. Again, peptides are working as signaling molecules to balance the system, whether we're using a healing peptide, a growth hormone peptide, such as Semorlin, we're using the BPC, TB, GHKCU. These are all natural substances that your body produces in and of itself. So because of that, the side effect profile is so low to almost like nothing. And a lot of times the poison is in the dose. So as long as you start on a low dose and work your way up and cycle on and off, you're pretty safe for the most part because again, it's working with your own natural biology rather than against it. And the body's smart. Like the body wants to be in a healthy state. So there's even things that I didn't talk about with BPC 157 in terms of like cell apoptosis, which is huge. And people think it actually does the opposite of cell apoptosis when it doesn't. So cell apoptosis, it just means it helps cancer cell death is what it does. And anytime we think like cancer cells, we need to think immune system dysregulation. So that's again where that TB 500 comes in because it helps with that immune system regulation. So we're helping with apoptosis and immune system regulation in terms of like apoptosis.
Mm-hmm. Mm-hmm.
So
Rana,
so many layered benefits of these things. It's almost like everyone is going to benefit from these types of peptides at multiple stages of their life.
right. Yeah. I had one question come in that it's a really good question, actually. Can you use the skin serum along with the injectable GHKCU? So can you use our Skin Plus with?
Yeah, you can, because even though it is a copper-based peptide, and copper, and so your body balances things in the body like magnesium, calcium, copper, and zinc. So those two kind of like play on each other. You have to take a really, really high level of the GHKCU, the copper-based peptide, to really throw off the system. And the levels that I know that people need to take to really throw the system off, it's no one's taking those. So you can use the topical as well as the injectable. Again, it just depends on like what your goal and what you're treating and why you would be taking both.
Mm-hmm. Okay. All right. Let's shine some light on a peptide we haven't really touched on, which is Semorlin. How can Semorlin indirectly support cellular repair through growth hormone simulation?
So these are some of my favorite ones is the growth hormone ones.
And actually, while we're on it, how do you say it? I've heard Semorlin, I've heard Semarelin.
Yeah, I've heard Summerell and Semorlin. Like they both like tomato.
Okay.
That's how I think about it. So Semorlin, yeah, whichever one comes to mind is the one I say. Now I'm thinking about how do I say it. But basically, again, these are growth hormone peptides, and there's multiple growth hormone peptides within this class, just like there's a bunch of different GLPs within that class as well, too. So, I mean, the main mechanism of action is the production of growth hormone. So growth hormone is a very important, unique hormone. It's considered a master hormone. It's kind of like at the top, and then everything kind of branches off from growth hormone. So this is kind of like the king of hormones. The way your growth hormone system works is it's produced in the anterior pituitary gland. So up here, like right in your skull. And it's produced on what's called as a pulsatile system. Pulsatile system meaning you're getting small pulses throughout the entire day. You get your largest pulse of it at night between like 10:30 and 12 while you sleep. That's when you get the largest one because it is very much like a healing peptide. Now, the difference between Somorelin and HGH, which is just taking straight up human growth hormone. So it's like you're not helping your body produce it, you're replacing growth hormone. The biggest thing that happens with that is it's not on a pulsatile system. It's just like straight up like one pulse. So you're not really tapping into the rhythms of the body. So with using the Somorelin with helping with the growth hormone production, it's following those pulses. So it's not creating artificial levels. It's creating natural levels. So you and I could both take Somorelin and it's going to affect us differently. It's not going to make you like all big and bulky and crazy. It's going to give your body the amount of growth hormone that you need. It's going to give my body the amount of growth hormone that I need for my physiology. So that's what's nice is it's not gender specific. It works based off of your own individual biology because there's intelligence with this. So it's going to help you produce the proper amount of growth hormone. And again, growth hormone can help with skin, nails. I mean, I have to get my hair cut like every week when I go on the growth hormone. It's growing so fast. I gotta trim my nails like every week because it's growing so fast. So it's helping with all those productions. So the main mechanism of action with this is it's going to help with lean muscle mass. So lean muscle mass. What I mean by lean muscle mass is another word to say is quality muscle. Quality muscle is muscle that has high levels of mitochondria. So this is going to help you produce quality muscle, not just big bulky muscles, but quality muscles that are insulin sensitive and have high levels of mitochondria. Those are two markers of longevity is again metabolic function. Metabolic function is measured off of your body's ability to process insulin, which stops first in the muscle. So if we can restore insulin sensitivity in the muscle first, we're winning. If we can increase mitochondria density, we're winning. So this helps with lean muscle or quality muscle mass. The next thing is it's going to improve stage 4 sleep. So our body cycles through different stages of sleep throughout the night. And as we age, we lose the ability to drop into what's called a stage 4 or REM sleep. That's the most restorative sleep. So, most people are waking up even more tired than when they went to sleep. Like it was like they never even slept. They're like, what happened? Like, I feel like I didn't even sleep. It starts to reverse engineer that where it starts to restore it. So it helps you get to sleep, fall asleep, and get into those sleep cycles even deeper. Sleep is very important. It's kind of like at the base of anyone's health and wellness journey because sleeps help manage levels of cortisol. It helps manage levels of ghrelin and leptin, which is like the hunger hormone. So it's going to help control appetite throughout the day. It's going to help your body's ability to regenerate. So this is huge in terms of what it's going to be able to do. And then, it helps with all these other downstreams effects, such as like inflammation, immune system. So it's like, again, these things are not like a one-trick pony. They're helping multiple systems within the body. It's pretty incredible, and that's why I can't say enough about these because anyone can benefit at any point in time because we all suffer from some sort of dysfunction within the body because the world that we live in is so artificial and it doesn't balance with our own natural cycles and rhythms anymore. So we're losing higher levels of the body's ability to produce stem cells, the tissue heal, to regenerate the nerves to where it used to be, and then to get into these deep levels of sleep and put on muscle mass. So again, you can pair this one with BPC 157 because this is going to help with your growth hormone. And then the BPC 157 helps with the growth hormone receptor. So it basically like amplifies the effect of that growth hormone. This is how we really plug and play with these things to get like expedited response with it.
What about, can you explain the difference between sermorelin, tesamorelin? I've heard ipamorelin. What are the, what, like, is there a difference between the three?
I know how deep you want to go down the rabbit hole, but okay.
Well, they asked. Let's tell them. They want to know. I want to know.
All right, so we have your growth hormone secretagogues, and we have two classes within growth hormone secretagogues. We have GHRH, and we have GHRP. They have, and we'll have different ones under each of these categories. So your GHRH stands for growth hormone releasing hormone. Growth hormone releasing hormone are the ones that cause the production of growth hormone. So they send a signal to the anterior pituitary gland to start the production. Just because you have the production doesn't mean it gets released into the bloodstream. This is where you pair it with a GHRP, a growth hormone releasing peptide. So one is the production valve, one is the release valve. Now, the three that fall under this GHRH category is sermorelin, DJC 1295, and tesamorelin. And then the ones that fall under this GHRP ones is hexorelin, MK, 7, and IPA. So you typically want to pair these together to get the ultimate effect with how they work. Now, these ones all work pretty well. These ones, the sermorelin and CJC 1295 are very similar on how they work. The tesamorelin is different. What makes the tesamorelin different is it specifically targets visceral fat around the organs, which we know is linked heavily to neurocognitive decline. So this one is going to target specifically visceral fat. These ones are more like subcutaneous fat. And this one is more visceral fat. Now, with your GHRPs right here, I never use hexorelin. There are clinical cases where you do use it sometimes, but for most people, they don't really need it. MK677, if you get on TikTok or Instagram, sometimes you're going to see a lot of guys taking MK677 because it, especially in like the bodybuilding space, because it does help you in a bulk when you're hungry. It makes you super, super hungry and you eat a ton of food. Like I don't need help with that right now. So I don't take that. I primarily will use ipamorelin if I'm pairing it with any of these three GHRHs because the other two, hexorelin and MK677, can increase prolactin and increase cortisol. So these again are more like your advanced GHRPs. The ipamorelin, that's not going to affect cortisol production or it's not going to affect prolactin production. So that's the one that I'm primarily using with them. So again, and you have different receptors for both. You have receptors for GHRHs and you have receptors for GHRP. So we are able to amplify and maximize the full system when we use these two together. And then again, if you add that BPC 157, it just like amplifies it even more.
And are any of these better to take in the morning, in the evening? I know you said it helps with rest and sleep. Should we take it right before bed?
Yeah, again, it's all depending on your goal. So if you, with the growth hormone releasing peptides, you want to take it on an empty stomach because your body's not going to produce the growth hormone if you have food in the stomach. So you have to take it either 30 minutes before your first meal or 2 hours after your last meal. So if you're eating around, 6 or 7 o'clock and you're going to bed around like 10, you got plenty of time to where your body has digested everything. You can take it before bed. So you can do that and that will help with sleep. I like to take them before bed and first thing in the morning with my workout. So it can help with sleep at night. But then if you take it before workout, it's going to make that workout even better in the morning when you're working out. Or you can take it after the workout because it's going to help with post-workout recovery. So it's very situational with my jujitsu guys. You know, they trained at night. They didn't get home till like 9:30. They would want to eat. I didn't want them to stay up till 11 o'clock to take the peptide. So I'd be like, dude, just take it like first thing in the morning. So again, it just like depends on like what works best with your schedule that you can be most consistent because it's all about consistency with that. I did see a question in there about AOD that I didn't talk about. It's 9606, I think. So AOD, it's a fragment. It's a growth hormone fragment. So it's like if you have an orange and you take everything from the orange and remove it and just have the vitamin C left. That's what like AOD is. AOD just helps with lipolysis and lipolysis and lipogenesis. So it helps stop the production of fat and then it increases fat breakdown. But to me, I don't really use AOD that much because these ones are already covering them. This is like the full spectrum. This is only a piece. You're not getting the other benefits of the fragment with the AOD because it doesn't have all the components. All it has is that one component to it. So you're not, I want to get all the other benefits. So that's why I'm just taking these ones over AODs. But if you got the money to waste, go ahead. Like I just have other stuff that I'd rather spend my money on than just a fragment of something and only getting a small benefit of it.
Yeah.
I also saw a thing about like trochees. Uh, these can work orally, but these are going to work better in terms of injection base. Way better. You're going to get a fraction of the benefit taking these orally versus in a trochee. Now, the only ones that work orally is basically like the BPC and the PB500. Those have a better effect, but those are more like gut-based, intestinal healing, inflammation healing. It's not for a knee injury, it can alleviate some of the pain, but you're not going to get the same level of regeneration. So those ones are the ones that you can take internally in a tablet form. You know, your body just kind of like breaks down too much of these peptides in the gastric system. So that's why like the efficiency of it with the injection is based. I know some people are trying to like encode it with like some water molecules to where it kind of bypasses the digestion. So people are trying to hack or encapsulate these peptides in a way that we can take them orally. We're just not there yet in terms of the technology where the oral version is as effective as the subcutaneous administration.
Mm-hmm. Well, with Elivatech, not sure if you've heard, but we do have wait. But okay, so now we've gone deep into the weeds on the science side of things. If we zoom out and just look at our everyday lives, like let's just start with like how can someone begin incorporating these peptides into their routine safely without too much experimentation, like obviously following whatever their provider gives them with those protocols, but in general, like what would you recommend?
Yeah, so if I was to build out a protocol for someone, let's say like month one, 1, 2, 1, 3. There's a couple different ones that we can build out here. Let's say this is like anti-aging. And this one right here is weight loss. So that way people can see two parallels of different programs. So anti-aging right here, I'm going to be microdosing ELP plus I'm going to add a growth hormone peptide. Right here for the weight loss, I'm going to be doing a higher dose of a GLP plus a growth hormone peptide. So the only variable that I really changed right there was my dose with my GLP. Microdose versus a higher dose. Now, another one that I also like to add in here, because again, we're driving so much in anabolism, is I like to add glutathione to both of these.
Can you write a little bit bigger? Just a tad bit bigger. Sorry. For us blind folk.
Yeah.
I need those eye drops, those GHKC drops.
Glutathione. So I like to add glutathione to both of these. And then again, I'm just going to change the frequency. This one is going to be 3 times per week. This one's going to be 2 times per week. So I just changed the frequency of adding the glutathione because again, our body is being exposed to so many environmental toxins, you just can't keep up. And whether it's like anti-aging or weight loss, your body stores a lot of toxins in your subcutaneous tissue. So as you start to lose the weight, you want to make sure that you're flushing those things out of your system. So again, that's where the frequency with the higher weight loss is 3 times a week versus just the anti-aging maintenance protocol. I'm just adding that twice a week. So I'm running these guys for like the first 2 to 3 months. And then all I'm going to do is I'm going to switch out my growth hormone peptide. And this is where I'm going to add DPC 157, TV 500. Both of these. Now, the reason I add, and I could keep them the same in terms of like the dosing schedule. You don't have to really change these ones in terms of the dosing schedule because it's very much like an anti-aging and it's also like a tissue-based healing. There's a couple nuances when it comes to weight loss as well too. So if your body is in this inflammatory state, your body cannot properly get into this lipolysis state to where it's able to break down the fat. So some people will become like quote unquote fat resistant. That's just like the words that we use to explain for something we don't really like understand. So what is happening is that person has so much inflammation in the body, it's your body doesn't feel safe to start to lose that weight. This is where TV 500, again, it has a nuance of an action of where it can indirectly help with weight loss because it modulates the cell in terms of that inflammatory state where it brings it down. And then the body feels safe to where it can start to lose the weight loss. So this is where like a few nuances of using these peptides come in hand. And then so now we've flipped on that weight loss with that person. We run this one for another 2 to 3 months. And then all I do is flip back and add that growth hormone one. And then I'm just kind of like going back and forth with that. So what I'm having to not do is I don't have to continue to increase that GLP dose, but we're making consistent results and we're working on other systems. We're repairing tissue, we're repairing healing, we're restoring hormone production, and we can flip those back and forth. And again, depending on like what your goal is, you could add in the skincare here. You could add in the GHKCU at one of these points as well here too, if as long as it like makes sense for you. You can switch out the glutathione for the NAD. So these are just like base frames, and I don't want to make it more complicated than it needs to be because a lot of people are like, what do I stack or what do I do next? And you just want to keep it simple and run that for a decent amount of time to let your body adjust to it and then make those small micro changes from there.
Mm-hmm. Yeah, a few people wanted to know how does NAD, I wasn't going to bring it up because not I don't know, it's technically restorative, but can you touch a little bit more on NAD and how it fits into this?
In terms of what?
Just like how does it fit into this general protocol? Like does it help with inflammation? Does it help with focus? Does it like what does it do and how does it fit into our lives big picture?
Right. So the way that NAD is is it's energy currency, similar to like helping with the production of like ATP, which is the energy currency of the body. And again, NAD is just one of those levers that dramatically decreases as we age, as we have high levels of inflammation, as we have insulin resistance. So these levels dramatically decrease. So if we can restore some NAD levels while we're bringing down inflammation, while we're restoring metabolic function, it's just going to help you feel better faster, because what NAD does is, again, it helps with this ATP production. And ATP production is, again, the currency of the cell. If that makes sense. The way I like to explain it is, again, your body has a list of things to do to survive. It has a basic list. Let's say that costs you 50K. All right, so that's our currency of what we need. Your body produces 150K ATP. See, so NAD levels, ATP, you're making enough to cover your living expenses. Problem is, most people are living beyond their means. What I mean by that is when you have metabolic dysfunction, chronic immune issues, inflammation, poor sleep, high levels of stress, that's costing you 250K and you did not get a raise. You're actually making less because now your body's producing less NAD, less ATP. So you're actually making 75K. So you're living beyond your needs. So you're maxing out your credit cards now just to cover your basic living expenses. Don't think about going on that nice vacation to Mexico. Like, that's out of the picture. You're not making enough. So this is where if we add NAD therapy in, we boost ATP, get you up to 275, so we can start to at least cover your living expenses so you're not always in the hole. You got to get you out of the hole. But then also, too, while we're running those other peptides, while we're improving insulin sensitivity with the GLPs, we're getting rid of inflammation, metabolic dysfunction, we're improving hormone levels, we're decreasing stress. So eventually, this restores back down to, let's say, 100K. But we've optimized your system because you still got a raise. So it just kind of helps. It helps overall with the entire system. Again, it's hard to say what NAD does for one thing, for one person, because everyone's going to respond differently, because these things are affecting hundreds of different systems, from boosting mitochondria health to reducing inflammation to restoring longevity pathways. So that's where it's just like, these things almost sound like panaceas. I don't want it to sound like that. I don't want to be like, just take NAD or just take ATP like it's going to solve all your problems. It's not going to solve all your problems, but it's going to get you on the right track.
Okay. Love it. All right. Well, we are just up on time. Let's see. Before we wrap up, one more thing. What is like your ending thought, your ending tip? What can someone do today, or mindset shift? Look, like if someone comes to you looking to optimize their health, what is the one tip that you would give them?
Again, that's always like situational, depending on the person, on honestly like where they're at. Everyone is at different places. Everyone's situation is unique as their own fingerprint. We all are at unique places. But there's really not a bad place to start with these things, whether it's starting on peptide therapy, even just one, even just microdosing a GLP, or running the BPC TV 500 stack, or some Morlin. anything you start to take in the right direction is going to start to improve your levels of health. So again, I can't really give like one level of advice other than just mm, like be open and yeah, just be open. I mean, the things that are coming down the pipeline in terms of regenerative medicine, these peptides that we just talked about today are literally just scratching the surface. There's 40, 50, 60, 70, 100 plus peptides that are out there. Whether it's the injectables or, we didn't even get into peptide bioregulators, or we didn't even talk about like exosome and stem cell therapy in terms of like MSCs or Muse cells, combining all these things together. There's so many things that are coming online to really help people, empower people, and help them take their health back. So the one thing is just you have to want to take your power back and take your life back and realize these things can help in such a powerful way. Yeah. I just can't say enough about it. And again, it's all situational depending on what I'm telling each person.
No, I love that. I think that's great advice because especially with Ellie, like you have such a strong community. Even reading like these comments, like I think Leanne said, like, oh, I take it morning and night, and someone else might only take it at night, or depending on what they're doing. So
Yeah.
obviously, like, don't follow your friend's protocol, but you have so much insight from so many people in this like Ellie community. And then obviously we have access to someone like you or anyone we bring on to the Thursday series. So
I
it's
mean,
really
this
good.
is like the next level of personalized medicine. Like this is truly personalized medicine at a cellular level because like I shared earlier, both you and I could take the growth hormone peptides, but because of the intelligence of the peptides in the human body, it meets us where we're at. It brings us into homeostasis with where I need to be versus where you need to be. So this is all very personalized medicine on a whole nother level.
Mm-hmm. Absolutely. Well, Dr. Wagner,
Yeah,
thank you so much for spending the past hour with us. And I think every time I meet with you or I see you be interviewed, it like gets better and better. Like now you have a whiteboard behind you. I know you've had it for a few weeks, but I've never gotten to interview you with a
sure.
whiteboard. So
Yeah.
thanks for stepping it up. And yeah, thank you all for being here tonight. Stay tuned for our Ellie birthday is coming up. We've been working so hard. So yeah, stay tuned for all the announcements coming in the month of June. We'll start with June 1st, but it'll just be a whole month long. We are the type of people that celebrate their birth month, not just their birthday. So stay tuned for that. Thank you guys so much.
Thank you, Janet.
Yay.